Welcome everybody to this webinar. Dr. Bashir Issak is the head of the Department of Family Health at the Ministry of Health, Kenya. He provides leadership and oversight for the divisions of reproductive and maternal health, child and neonatal health, adolescent health, primary health care, and nutrition and dietetics. He is also a member of the National Committee on Maintaining Essential Health Services amid COVID-19 pandemic. He has over 20 years of experience in maternal and reproductive health, providing technical leadership, coordinating, implementing various health interventions, and as well as overseeing the development of relevant policies and guidelines. Ladies and gentlemen, I now welcome Dr. Bashir to take us through the experiences and the best practices that have been recorded in Kenya in terms of the RMNCAH scorecard. Thank you very much. Over to you, Dr. Bashir.
Thank you very much, Robert and colleagues. Good afternoon. It's my pleasure to share the Kenyan experience on the RMNCAH scorecard. As alluded to, that is who I am. Can you give me the next slide, please? Just to provide a background on to the RMNCAH scorecard in Kenya. The scorecard is an integrated action-oriented management and accountability tool that has been alluded to earlier. Kenya has made remarkable progress in improving RMNCAH outcomes during the last decade. Improving access and coverage for these services is a priority for the government of Kenya. Kenya has shown encouraging improvements in maternal health outcomes since 2003 to 2020, but maternal mortality still remains a challenge with 362 per 100,000 live births. The significant improvement in outcomes is not homogeneous across all counties. The scorecard has been instrumental in showing these disparities and therefore guiding on where we need heavy investments to reduce the disparities. The government has introduced new policies to address critical barriers to access and utilization of RMNCAH services. And initiatives like Linda Mama, which actually in Kiswahili means take care of the mother, free maternity services, a presidential initiative where mothers will be provided with free delivery services in all public health and faith-based facilities with reimbursement by the national government. Now it is through the National Hospital Insurance Fund, and also Beyond Zero initiative, which is spearheaded by our First Lady, aimed at ensuring that no woman dies while giving life. Next. The history of the tool in Kenya. It was first introduced in 2014 and is now publicly available on the Scorecard Hub as being mentioned by the previous speakers. It was first developed in 2014 by the Kenya Ministry of Health with support from ALMA and other RMNCAH partners. The scorecard was rolled out to county levels from 2015. Counties are the sub-national levels for this country. We have 47 counties as a country, and this is devolution that happened after our 2010 constitution. So with training of key county officers, the partners that supported this are UNICEF, PIMA, Options, and others. We continue to support the scorecard in several counties. Since then, almost all counties have been trained and retrained and are producing and reviewing the scorecard and tracking actions. Tana River and Nyandarua counties mobilized their own resources to decentralize the scorecard to sub-county level. That's now one level below the county. And as part of maturity of the RMNCAH scorecard, other scorecards, such as the National Vaccines and Immunization Program, nutrition scorecards, and community health scorecards have been developed in Kenya. The scorecard is still undergoing, is also undergoing revision in tandem with the evolving country RMNCAH situation. This revision has been dictated to by the issues of more categories of interest coming up in the country, like adolescent health. Other area we realized from the implementation experience that other areas were not adequately covered, like the child health, and also changes in national and global policies, especially on the policy of first aid ANC coverage, where initially we used to say 4 coverage were adequate, and now it's 8 coverage. So because of this and other reasons, we are trying to review and revise the scorecard. In 2021, the scorecard was publicly shared on the Scorecard Hub, a new Pan-African platform launched by His Excellency Uhuru Kenyatta, which you have just watched in the video, the President of Kenya and Chair of ALMA. Next. Why the scorecard in Kenya? It's an effective mechanism to manage performance of health systems at all levels and improve services. We will look at both the national level and the county level, which is a subnational, uses of this scorecard. It helps in accountability and holds leaders and service providers accountable to improve the health of women and children in line with the Constitution, Vision 2030, and regional and global commitments. It helps in tracking performance for SDGs and measures progress against national health policy and strategy. And it's also used for advocacy and to highlight areas of need, success for national initiatives, such as Her Excellency's, the First Lady's Beyond Zero campaign, and also global accountability to track the global commitments to Kenya. In the county, at the county level, we monitor RMNCAH program performance against county and national RMNCAH strategies and trigger action. Whichever of the counties is not doing progress, we use this scorecard for them to compete among themselves. Identify challenges and best practices, as mentioned earlier, and identify areas doing well and those with bottlenecks to remove the bottlenecks. Transparency and advocacy and prioritization. County government and partners are made aware of RMNCAH progress and challenges based on evidence advocacy. Mutual accountability and dialogue with community and civil society. Communities hold leaders accountable at that level. Next. The indicators, there are about 26 indicators in the current RMNCAH, both national and county level, across 7 categories spanning the complete continuum of care. But this is undergoing revision. We are reducing the indicators to 25 and also expanding the categories to 8. The category that has been included is the adolescent health category. Next. Best practices and experience in using the scorecard countrywide achievements. Some have already been mentioned, but the most significant achievement is the decentralization of the scorecard to all of Kenya's new and highly decentralized county governments. This has been critical since county governments are responsible for health service provision, including planning, budgeting, and financing. With accountability on the wall, you see on the notice board, the community can look at that and hold the direct service providers accountable for the actions. Next. Examples of best practices in the use of scorecard are health system strengthening. The RMNCAH scorecard is a key management tool for strengthening health systems at all levels. For example, in Siaya and Migori counties, the scorecard was linked to revitalization of the community units. It was used for the community to interact and make improvement in implementation of the community strategy. There has been shown data improvement. Counties indicated improvement in data reporting and quality since review of the scorecard data on a routine basis leads to greater demand by managers for accurate data. The counties also widely reported that members of the county assemblies, these are the parliamentarians at county level, were using the scorecard data to solicit money for respective wards, and that increase in county assembly fund allocations for this service or training were occurring. Accountability and use of staff performance management. Ownership of the scorecard process and resultant changes in management practices have also been widely reported. Gaps and underperforming indicators shown on the scorecard have led to greater use of bottleneck analysis to agree upon the most appropriate response. Resource mobilization. The scorecard is also used by counties as an advocacy and resource mobilization tool. In Migori County, family planning commodity coverage was found to be below 40%. The scorecard was used to advocate for increased county funding for related services from between $100,000 to $140,000. The increased funds have been used for FP activities and commodities. Next. In service delivery improvements, using the scorecard tool, mechanisms for identification of bottlenecks and follow-up on actions has contributed to several improvements across the indicators, including skill deliveries and immunization coverage. For example, in Garissa, following the review, program officers identified actions to increase coverage of underperforming indicators. Actions included outreach for immunization, increased outreach for immunization, emergency obstetric and newborn care training, and engaging community health volunteers to refer mothers for skill delivery. This increased immunization from 48 to 82%, and skill delivery rose from 28 to 45% over the same period. In Bungoma County, the scorecard review showed skill deliveries were just over 50%. This led to investment in reorientation of the traditional bound attendants, TBAs, with 400 TBAs trained and supported more than 14,900 women to go to health facilities for skill birth assistance. Next. The lessons learned and key success factors. The lessons learned of the Kenya's RMNCAH scorecard use is leadership commitment. Implementation of Kenya's RMNCAH scorecard tool is embedded in the Ministry of Health performance contracts, published regularly and disseminated widely in a timely fashion within 1 month of the end of each quarter. Strong leadership and commitment by both national and county leaders on the scorecard enhances its use to identify bottlenecks, make recommendations, track actions, and ultimately improve performance. Decentralization of the scorecard enhances ownership and improves the use of the scorecard as a management tool to improve performance at all levels. Integrated into systems. Integration of the scorecard web platform with the Kenya Health Information System 2 enhances regular quarterly production, allows inclusion of facility level data, and improves data quality. Use of the action tracker has facilitated improved quality and efficiency of management meeting discussions and served as an accessible system to track implementation of agreed actions linked to indicator underperformance. Next. Best practices on the hub, and this is the link to the hub which was presented earlier for the scorecards and for best practices. Next. And this shows us examples of the counties that have best practices. In Kenya, I think they're Migori, you'll see the profiles of and the best practices of different counties for Kenya. There are about 3, Migori, Siaya, and Bungoma. Thank you.